to show some Thai massage techniques on a mat today. Mandy's having problems with her upper back on this right side. And I'm just starting with her arm because I'm trying to access her arm to access her shoulder blade, which then pulls into her upper back. Typically, traditionally in Thai massage, you start lateral, meaning you start at the extremities and then you slowly work your way in. She doesn't have a lot of tension in her hand, but through the forearm, this little top section, I'm going to give it a little work here. The good thing about Thai massage is I'm able to move my body around in whatever way feels good to me. It's pretty infinitely versatile. I work on a mat professionally. There's not even a table in my studio currently. Is it too much pressure, Mandy? I'm just stacking my shoulder above my wrist in a way that feels comfortable. There's a little crease right at my wrist that you can see, but this doesn't feel bad. I can probably hold this for a minute or so. This is a pin. I'm going to give her a little bit of what I call pin and stretch, but it's working through that tissue. A little bit of mobility through the radius by grabbing the hand there. Going to work through her thenar, right along the thumb. You can see that little mark is just from the compression. If I get tired of being on one leg, I can always switch, change it up. Again, just so long as I'm comfortable and I can distribute body weight in a way that's comfortable. Right there. Let me know if it's too much pressure, Mandy. This is right at the top of the forearm flexors. Lots of people are using these when they're typing, when their hands are curled. And if we're lucky, I suspect that Stella's going to come for a visit. Because if I work on you in your home, your cat or dog will come and hang out, try to lay on my mat. Well, because it's the coolest place in the whole house. There we go. Pretty good there. Yeah. Now, I felt some tension through here. I'm going through to feel what's going on. A little more tension right there. I'm going to feel around the humerus, around the bicep and tricep, this junction here. This feels pretty soft and pliable. She's a little ticklish. I'm going to back off. This little portion here still feels a little dense. I'm going to change the position just a little bit. When I move her arm up, it makes that come up so that I can sink down into it instead of it being hidden underneath. I'm just making sure that her elbow and shoulder joint can move that way without any discomfort. How's that, Mandy? There we go. Now, you'll notice as I come in and sink in here, you'll notice the hand movement, even the fingers as I press. It's because all of the muscles through the forearm extensors and flexors control a lot of those movements. We're using the forearms to move. And how's that right there, Mandy? Okay. Now I'm going to lean in. When I lean in, I wind up stacking my shoulder above my wrist. Then I'm going to move her fingers and hand just a bit. Again, a pin and a stretch. All this movement through here. I'm checking Mandy's facial expression to make sure I'm not using too much pressure. Gives her some length in the forearm extensors while I'm pressing into the flexors. and again, right across into this line, right at the ulna. When I pressed, the muscle slid, it kind of bounced to the side. When I use a big broad palm, that's less of an issue because I'm using a bigger structure to press on it. If I press into a ropey band that's the size of my thumb, it's likely that my thumb will slide off. So I flattened the finger pad on my thumb to access some of that. Not too bad, Mandy? Yeah. I'll check the opposite side at our forearm extensors. These don't feel too bad. They may be pulled a little bit tight over the radius and ulna. Again, sort of a pin and stretch. Working my way back towards the upper back, but I don't want to ignore the arm. Slowly working through, tractioning. This is going to pull even into her neck. This grip I have around the forearms, I can traction skin right here into the forearm extensors. You can see that as I press, her hand moves, just because, again, those muscles control the movement through there. Tender? Yep. Unfortunately, you picked an area that I know very well because I have to work with my hands all day. Right in there. To change direction, I'm going to pull up. I'm going to start to feel what's the range of motion through the shoulder blade. I'm going to bring a right palm to her left shoulder. It means that I can hold onto the humerus here, right about at the elbow. I'm able to cover breast tissue so that the client feels safe, but I'm using this as a handle to get the shoulder blade to move around. When I teach this to massage therapists, they often get inordinately confused because many times in what people think of as traditional massage, on a table, they're putting their hands right where the pain is. Whereas what I often am doing is I'm using one part of the body as a handle to pull, lengthen, and mobilize the area that's bothering them. If she's feeling a problem back here, I'm accessing that tissue by pressing where I'm at now. Then I'm gonna brace my hand and work right into the rhomboids there, trapezius. Eventually, if her hand starts to move around, it's completely fine because I've still got this handle. If it doesn't seem to quite work for you, you can always lift the hand back into place. And I'm going to move them around. My fingers can be right at the erector spinae group, cross fiber frictioning. It's like I'm tossing her back and forth over my propped fingers. I'm letting gravity as much as possible do the work for me. And in her case, I want to give her a little more movement through that shoulder blade. I'm going to hop over. Give her a little more twist there. Really slow, gentle movement. I can again grab through the forearm if I want. Thai massage really allows me to use body weight. It means that as I work on a mat, my hips, hamstrings are more open. I'm going to pull Mandy over. Aha! Now I get to work right in there. If I loop her over my thigh, then my right hand is free, right in there. And this way, if she laughs, you can't see her. Right there, Mandy. Let her back down, just to balance out. You wouldn't want to keep her in that solid twist for too long. I'm going to reach into this area of supraspinatus. Let me come around, see if I can get a better angle. Can lift the hair out of the way. Mandy is having some problems with her supraspinatus. In previous videos, I've talked about infraspinatus, which means below the spine of the scapula. Infra, like infrared, below the red on the spectrum. Supraspinatus is above the spine of the scapula, so right on top of the shoulder blade. And this muscle feeds down into the head of the humerus after going underneath this portion of the shoulder. A little bit of tenderness there, Mandy. Now, it seemed like it was a little tender for her, so I'm going to back off and just lengthen through here. We're going to build up into that area. I'm going to transition back and forth, side to side. This also gets a little bit of pec, maybe some pec minor as they lean down, opens the chest. To give her more opening through the chest, I'm going to take a blanket, fold this guy in half. These guys wind up being just about the height of the mat, which gives me a little room back here if I have to move around. I got another blanket, I think a pillow. And this is one of my favorite ways to work on the upper back. I'm going to lift Mandy with my right foot on the right side of her spine, left foot on the left side. I'm just between the shoulder blades at their inferior angle. I'm gonna bring a blanket in place. See if I can get a good pillow here. Let's see if that gives her enough cushion. That looks like she's supported well enough. I'm gonna lift the hair out of the way. Takes a second to get situated. How's that, Mandy? Now, it's a little more challenging to see this. My feet are doing the work. My toes are gently curled back. The pads of my feet are pressing and allowing this little bit of back bend that Mandy has. I'm still able to use my thumb to get right up into this spot. But now we've changed the position of her shoulder blade. She flinched just for a second there. It was just ticklish or tender. Yeah. So I'm grabbing traps gently between my pointer finger and thumb and lengthening. You can see that this is an easy way to get her to back bend because I am the prop. I'm able to grab tissue, and you can see she moves as I push my feet down. It's like I'm tractioning the skin of her back. This is another reason why I'm very, very particular about mat-based bodywork. It gives me more options. I can literally use all of my body, my knees, my legs, in addition to my hands and arms. How's that there? A little tender? Yeah. So now I'm holding with my thumb and using my feet to just jostle her back and forth, side to side. If I need to change my own position to make myself more comfortable, I do. I can put my arms back. I can sit back for a second. I can use the right foot to reach on the right side. I can even press the toes. I'm arms. She's starting to open up more. I can feel her shoulder blades start to shift over my foot. Then backing off on the right, I'm going to press on the left side just to balance it out. She gets a more open, expanded chest. I get a chance to work on her back completely hands-free. This is why when I'm dealing with education for massage therapists, I actually lament the fact that we've not created a mat culture for bodywork in the United States, because massage therapists come to me and tell me their hands hurt. I do this and go, why? And they say, well, because we've never seen that before. And that's a big challenge in the education process. 9 times out of 10, in addition, clients like Mandy will prefer this. I'm using the thumbs to demonstrate what the toes are doing, because my toes are pressing right between the shoulder blades along her spine. You can see the movement there. This is just the right foot, that's just the left, and that's both. We'll see the difference. This area has softened. Her shoulder blades have opened more. I'm going to lift and see if I can come just a little bit higher in her upper back. If I need to scoot off of my mat, again, I got my blanket. I'm at this junction in her upper back. See if I can get toes visible there. I've got the ball pad of either foot right at the top of the shoulder blade, along levator scapula, trapezius. I'm going to lean a little bit more into the right side. I'm pressing the right ball pad right at this junction. She feels a little tighter right there. The good thing again about this is I feel like I'm giving very thorough work to the upper back, but I'm doing it in a hands-free way. It means that I have more longevity in my career, and frankly, my clients just prefer it. 9 times out of 10, clients will get mat work with me and tell me that they feel like they wasted money getting table massage compared to how effective what I was doing was for them. How's the left side comparatively, Mandy?
The left side is
Don't feel much? Yeah. The right side feels dense to me. The left side feels like soft and kind of pliable. It doesn't feel like there's much going on there. It's a challenge at first to be able to feel with your feet. This is an excellent way to do this. Right there. Giving her some pressure. When I was using a thumb, it was too sharp. It was too pointed. When I'm using the ball pad of my foot, it's very broad. I can usually get a deeper release without what I call frogging the client, where I've used too much pressure, too fast, too sharp, makes them tense up. I'm gonna press down on both sides. And in Mandy's case, I'm going to lean forward with my shins. When I lean forward with my shins, you'll notice that it lifted her head with the bolster, the prop here. I want to be able to reach underneath and walk my feet back underneath her shoulder blade. There we go. And now, I'm back where we started, but I'm using this to then lift and lengthen the spine. I'll actually pull the pillow out of the way so you can see more of this for the moment. I'm actually tractioning her spine, tractioning her cervical spine particularly, lifting her back up and over my feet. Now I've got all this range of motion through the neck. I can move her around any direction I choose. Using that to feel through the neck. I'm gonna lift her head up and over to get some length on this side. How's that, Mandy? This also is a nice contrast because we had her doing a back bend previously. Now I'm guiding her forward. I can catch right along the paraspinal musculature at the neck and glide. And let her fall back again. And then I'm going to reverse sides. Give her a little length. Going to reach up. Can't see my hand, but it's the same thing I did on the opposite side. Back again. And the same area. I can grab, can move that around. Now, her eye gaze goes dead center, guiding her forward, opening up the cervical spine. And back again. If I take Mandy and lift her up to get her propped, I can slide the hair out of the way. That momentary mobilization where I'm moving them around doesn't usually seem to bother the clients. Her head falls back a little bit. I'm gonna grab her arms, bring them out and open. I can tell by her facial expression it feels calm, relaxed. I'm gonna give her a little bit of length. Big in-breath for me. And exhale. And I'm leaning back, the traction through the arms. Can put the arms down again. All of this is now open through the chest. It's very common for me to then do something like this where I'll put a towel over the top, and it allows me to work pectoralis and pec minor with my fingers, potentially my palm. When I'm working with female clients, this is a very nice option because they feel comforted, calm, supported. They feel safe when I put the towel over. Also, as I'm pressing down, she's pressing down into my feet. So there's a bit of a compression to either side. Right in there. I too, of course, get to move around, shift my position. To take Mandy out, I'm going to reach underneath. I'm going to support the head and neck. I'm going to slide my pillow out, slide out my extra bolster, and I'm going to slowly lower her down onto the tops of my feet and then slide them out. I can then come in and take a closer look right into this junction again. This feels very soft and pliable from where we started. I'm going to reach the thumb into supraspinatus. Still feel a little tension there. Just guiding the thumb right into that little groove. If I decide I want to work along the spine, at the top of the thoracic spine, I can always reach underneath. This way I can move her around. You can see I can lift her with my fingers just to press through there. Still feels more open than when we started. Tissue is softening there. Long-term working on a mat gives me all these options for movement to be able to access muscle. What I consistently tell people as an educator is that muscles cause movement, and we're going to use movement to unwind those same muscles. 9 times out of 10, if movement is restricted, it seems like pain starts to result. So I go in and try to restore normal range of motion. Gonna work either side of the spine. Sliding up. Can always move. When I'm sitting like this, it allows me very slowly to just roll through my own hips and stretch. Thai massage is sometimes called Thai yoga massage in the West. I just honor the fact that it allows me to move, to mobilize. I don't feel stuck in one position. I'm going to give Mandy a little length. Scalenus medius. Gonna try the other side. I think she had a belly grumble. I think that stomach grumble is called borgissimus, I think is how it's pronounced. And part of what I tell clients is it means they're relaxed. If you go into fight or flight mode because you're running away from a tiger, it doesn't matter if your lunch got digested. When people relax and their belly grumbles in session, where it's quiet, they'll often apologize, but I explain to them that it's good. It just means that they're going into parasympathetic, which is rest and relaxation. It's good. Sliding along. Mandy's got a little tension right at the base of her skull. I'm gonna prop her head right over my fingers so I can hook in. I'm gonna do this to both sides so you can see it from different angles. I can guide a little motion there. Switching sides, I'm going to use these 2 fingers. I'll glide up the cervical spine, right into the occiput, right at the right side. I'm going to guide her in. Her head is falling down on my middle and pointer finger. Lots of muscles connect here from trapezius, levator scapula, splenius cervicis, and capitis, I believe, in addition to the suboccipitals. Right over here, if it's a little more dense, I'm gonna stack her again, finding the dense spot and letting her hang out there. Give her a little motion through the cervical spine by having her head to the side. Kind of traction and mobilize. Lots of people think of Thai massage as just stretching, and increasingly over the years my sessions have been more compression based. I've actually gotten to a point where I don't even prefer the word stretch. Mobilize captures a bit more of what I'm doing because I'm using a mobilization to find the area of tension so I can then release it. Stretching in and of itself has limited therapeutic value. Not that it has no limit, it just has its own limitation. Just more tension on her right side. I can tell everything we've done a little bit tighter. But Mandy is right-handed. I presume she is right-legged. She is right dominant. She uses her mouse on the right side. Now that we brought Mandy back to center, I'm just guiding along either side of the spine. Still softening that junction between the upper back and the neck, that so many people have problems with. I'm going to repeat this guy, but now with a strip. Her eye gaze goes to the left hip. Then eye gaze goes to the right hip while I lengthen the left. Then a last one in the center. I have to balance her head on my forearms so I can grab, lift, and lengthen both sides. And slowly back off. Give her some length. Placing her head down so I don't ruffle her hair too bad or her makeup. I'm just going to work on her ears to finish up. Tons of options. I continue in my practice to, in a sense, break the rules. Meaning I don't do it always the way I was taught. I've had 14 years experience experimenting with clients where I continued to get feedback from them about what was working and what was not. So it began to transform my work to something that was more effective, helped people with their back pain. Tractioning over the ear. And how's that, Mandy?
It's really good.
Good. Thank you for... Feels better? Good. Thank you for working with me today.
Thank you.
Thank you so much for watching the video today. If you have more questions about Thai massage or other sorts of videos for the Psychetruth channel, please comment down below and let us know what you'd like to see. We're happy to provide content for you. You can visit my website at robertgardnerwellness.com and download a free Thai massage workbook. Thank you.